Hey, Nigel. What are you doing there?
Well, I'm just trying to make sure that my name is really easy to read, so I thought I would try to hold up this black thing because the mug is white, but I don't know. I don't know if it's going to work.
And why are you trying to do that?
Well, I just want people to be able to read my name because I want to make sure everyone knows who I am, and we don't always introduce ourselves. So I thought,
that's right.
I don't know. I don't know. I was just thinking about maybe contrast and making it easier to see.
Nice. Well, yeah, it's kind of interesting if we think about it in terms of medical device and trial work, which we do.
Let's do that.
Okay. So one of the things that we're trying to do a lot of is deliver drugs to certain regions in the body.
Yeah.
And one of the things, talking about contrast, that I like to use in some of the trial work that I do is contrast agents.
Yeah, right. And that's for like X-rays or imaging, different parts of the anatomy?
Yeah, so it depends on what kind of imaging modality that you're going to be using. So if you're going to use something like an X-ray, for example, our tissue isn't good at stopping electrons, but a bone is, right? It's a contrast agent, so you could,
So you don't need a contrast agent for like a typical X-ray?
For bones, but if you're trying to image something that is, say, soft tissue or something, or say
an organ.
So an organ or a region in the body that doesn't have bone or dense material, then you'll need to use a contrast agent.
Right, gotcha. And so are there specific types of agents that work for specific parts of your anatomy? Or?
There are, and we ran a couple of trials recently looking at the nasal anatomy, right? Which you think about, it's like this is just a lot of soft tissue there, and so there's a number of contrast agents, which ironically, well, I guess maybe not ironically is the right word, but
I'll ask my grade 8 English teacher if it's ironic or not.
But interestingly, aren't approved for use in that area, and so in terms of trying to find the right contrast agent can be quite difficult.
Is that because it's dangerous or because it's like ineffective?
Like with all things in medical device engineering, it is risk mitigation, right? If it hasn't been done there before, there isn't a predicate. You want to make sure that it's safe. So a lot of interesting work that has to happen there.
And so, are there specific agents that are interesting or more effective for certain parts of the body, like that get absorbed more readily in certain areas besides the nose?
Yeah, and look, I think that's one of the issues with the approval of some of these different agents is exactly that. Like, hey, if this thing gets absorbed into the tissue for a long period of time, what are the implications of that? No one's really studied that, so that's an issue. So there's a number of different approved things, like barium salts are a classic, right? You think that
the gross stuff.
Yeah, exactly. But yeah, it's fascinating. In fact, it's probably something we could delve into in some more detail at some other point.
Let's do it. All right. Thanks for that. I'll keep working on this while we figure this out.
Very nice. Well, hopefully we can see your name, Nigel.
Yeah, well, maybe I'll get you in there too.
Awesome.
Excellent.
Thanks.